Good morning, everyone. My name is Loli Rico, and I'm the co-director of the FCJ Refugee Center. Welcome to our seminal webinars, and today we will talk about COVID-19 vaccinations, and we have the honor to have two presenters, amazing doctors, that they are coming from the Crossroads Clinic from Women's College, who will be presenting us what is the benefit in relation with the vaccine, and also they are more than happy to answer some questions. We have with us Prasida Janakiram and Vanessa Reddit, and they will be start with our presentation with Vanessa. Welcome, Prasida, and welcome, Vanessa.
All right, thank you so much. And I apologize that I'm having some technical difficulties, and so I can't, you won't see my face, but hopefully you can all hear me. So we are family doctors at the Crossroads Clinic, and we've been receiving lots of questions about the COVID-19 vaccines. There's lots of information that's circulating, and we wanted to use this opportunity to explain how the vaccines work and trying to answer some of your questions. So we've collected what we see as being some of the most common questions about COVID-19 vaccines that we're going to go through, and then we welcome your questions at the end of this presentation. So we want to start out by really acknowledging that COVID-19 has had a disproportionate impact on newcomers and refugees. And often this reason is because people are working in frontline essential work with higher exposure to COVID-19. And that also people may be living in settings where there's more crowded housing, people are taking buses, and again, have more exposure to becoming infected with COVID-19 and possibly becoming more sick. We also really want to acknowledge that, you know, there are very understandable questions about COVID-19 vaccines because of long-standing social inequities and barriers to accessing healthcare that racialized individuals in particular have experienced. And so we recognize that there are very valid questions about the vaccines, but we are here to answer some of those questions so that and provide you with accurate information so that you can make decisions that are informed by this information that feel right for you and for your loved ones. So we're going to start off with, or the plan for this talk is to go through some of these questions. How do vaccines work? How effective are they? What are side effects? How are they produced so quickly? Were they tested in diverse populations? What's in the vaccines? Talk about allergies and what we still need to do. So to start off with, we want to get back into the science of how the vaccines work. So we're going to be talking today about the COVID mRNA vaccines because these are the ones that have been approved for use so far in Canada. So you have probably heard about the Pfizer, BioNTech, and Moderna vaccines, and these are both in the category of COVID mRNA vaccines. So how do these mRNA vaccines work? So the main point is that the vaccines teach your body what the COVID-19 virus looks like, so you can fight the virus if you come into contact with it. So what happens is you probably are familiar with this picture of the COVID-19 virus, and it is covered on the outside with what we call these spike proteins. Think about these spike proteins as like a little ID badge for the virus. It shows that, yes, this is the COVID-19 virus. So the mRNA vaccines, they have messenger mRNA, that's mRNA. These are like little instructions for how to make that spike protein. It's like a little instruction sheet, okay? So we get injected with the vaccine with the mRNA, with this instruction sheet. And then your body cells make a copy of that spike protein. Then they don't need that instruction sheet any longer, they get rid of it. But your body is now seeing that spike protein and it recognizes, hey, that's not part of my body. That doesn't belong here. And so your immune system, the system that fights off infections, starts to build up antibodies and other parts of your defense to fight it off. So now your body has learned, what does the COVID-19 virus look like? It recognizes that ID badge, that spike protein, so that if you come into contact with the real virus in the future, your body says, hey, I recognize that ID badge. I recognize that virus. That's not supposed to be in here. And it mounts your immune system to fight it off so that you don't become sick from the virus. So there are lots of good questions about, well, how is mRNA different from DNA, and will this affect our genetic material? So I'm going to take a step back into maybe our high school science classes, and I love science, so bear with me, to talk about what's the difference between DNA, mRNA, and proteins. So DNA is like our instruction manual for our whole body. It provides instructions for how our different body parts are going to be made, how different things function. So it's that book of instructions. mRNA, messenger RNA, is like a copy of a set of instructions. It's like writing down a set of instructions on a little piece of paper that then goes into the main part of your cell where you produce proteins, kind of like going into the kitchen or into the workshop and you actually make those proteins. This is how our body works. We have DNA, that instruction manual, mRNA, just that instruction sheet that gets where our body gets rid of it afterwards, and that instruction sheet is used to make proteins. So with the vaccines, we're receiving just that messenger RNA, just that instruction sheet that is used to make the proteins. That instruction sheet doesn't go back into the nucleus of the cell. It doesn't mix with our DNA. It doesn't mix with our, that more permanent set of that instruction manual. Okay, so the main point here is that the mRNA does not affect our DNA. The other thing is, remember, as I said, once we've made that protein, that little spike protein, we don't need the instruction sheet anymore. Actually, our bodies get rid of the actual vaccine contents. What remains in us is our body's immune system that has learned how to recognize the spike protein. So a question that has come up is, can we get COVID-19 from the vaccine? No, we can't. Why not? Well, as we just went through, the COVID-19 vaccines don't contain the live virus. They cause your body to make the copy of the spike protein, not the virus itself, right? So just that little spike protein. One thing that is important to note is that sometimes there may be short-term side effects from the vaccines, which Dr. Prasida is going to talk about more. So, sore arm, maybe feeling fatigued, things that you'll recognize from when you've gotten other vaccines. And those can be similar to the symptoms of COVID, but those are the side effects of the vaccine. They're not because you've actually gotten the infection from the vaccine, okay? And when you get those side effects, it's actually a demonstration that your body's immune system is working hard to build up its defenses. So how effective are the COVID vaccines? So we're going to talk a little bit about these big vaccine clinical trials, these big scientific studies that were done to investigate the effectiveness and the safety of the vaccines. So these were very, very large studies. In the case of the Pfizer vaccine, it included over 40,000 participants, and in Moderna, over 30,000 participants. They were over 16 years old in Pfizer and over 18 in Moderna. And in both studies, participants received 2 vaccines, either 21 days apart or 28 days apart, okay? And what happens in a study is that half of the participants get the real vaccine and half of the participants get an injection that doesn't have the vaccine. And then the researchers follow those participants to see, do they become sick from COVID, and do they, what kind of side effects do they develop? Okay, so what did they find out? They found out that the 2 vaccines were about 95% effective after getting 2 doses in protecting people from getting sick from COVID. And this is remarkable. This shows that the vaccines are very, very effective in preventing COVID-19 illness. And this efficacy, this effectiveness, was consistent across age, gender, and different race and ethnicity demographics. So this is fantastic news. One thing that I'll just highlight on this slide is some people have asked, well, can children get the vaccines? And the vaccines are not yet approved for use in children because, as you can see in the studies, it didn't yet include children. So there are studies that are taking place right now with the Moderna and with the Pfizer vaccines with children down to the age of 12, and then it will be with younger children. So we hope that maybe by the end of 2021 or maybe early in 2022, these vaccines will be available and approved for children, but they need to be studied in that age group. So some things that we're still learning about the vaccines, well, and a really important question is, how effective are they against the new variants? This is an area that we're still studying, we're still learning about because the variants weren't circulating at the time of these big clinical trials. But what we're learning right now and looking at the virus variants is that we believe the vaccines will be at least in part effective against the variants. So this is good news. There are good questions about how long does the vaccine provide immune protection? Well, we don't know yet. This is something that we're continuing to study. The clinical trials followed people for at least 2 months after they got the vaccines, which is great news because that is a really more than adequate time frame to assess the safety of the vaccines, because if there are going to be side effects, they usually appear within the first 6 weeks of receiving vaccines. But we're still learning how long the vaccines will protect us. Will we need a booster dose, like the way that we get a flu vaccine every year? Or will we just need it every couple of years, the way that we get a tetanus vaccine every 10 years? This is something that is being actively researched. And do the vaccines prevent spread of COVID-19? So as I mentioned, the studies looked at how effective the vaccines are in protecting against COVID-19 illness, getting sick from COVID. They didn't actually study whether people were just carrying the virus. So this is something that we're still looking at. There's some emerging evidence that may suggest that people are less likely to spread COVID once they've received the vaccine, but this is something that is an area of ongoing research. So I'm going to hand over to Dr. Prasida to talk about side effects of the COVID-19 vaccines.
Thanks, Vanessa. So what are the common side effects of the COVID-19 vaccine? I think what's so important here is to think about maybe side effects you've had from other vaccines you've had in your life. The COVID-19 vaccine has very similar side effects to some of the more common vaccines we know. The most common side effects with COVID-19 vaccine are the ones we see listed here. Ones of pain, possibly at the injection site where you get the vaccine, headache, or feeling a little bit tired for a day or two. Some people can experience like muscle and joint pain. Some people can have a fever, perhaps overnight for a day or two. And some people can have a bit of swelling or discomfort in the armpit, specifically with the Moderna vaccine. Now, that's the most common side effects, meaning that 1 out of 10 doses might experience that. There's also some common side effects that may be 1 in 100 up to 1 in 10. And in those cases, individuals may experience a bit of redness again, or a bit of swelling specifically at the injection site. So not just pain, but maybe a bit of redness and swelling. Some people may experience nausea and vomiting. Very uncommon side effects might be some enlarged lymph nodes, which are glands we have in our bodies that respond when there's a bit of an immune response. And that can happen sometimes under the armpit or in the neck area. very rare side effects where we think more about the very serious allergic reactions to a vaccine called anaphylaxis. That can happen very rarely. And what we need to know is that with most vaccines we've experienced in our lifetime, the risk of those very rare and unusual allergic reactions could be 1 in a million. In the case of the Pfizer vaccine, that rare side effect might be more around 4.7 out of a million. And again, with Moderna, 2.5 out of a million. So still very rare and really not an issue for the majority of the population who receives the vaccine. What I think is really the take-home message here is to know that these side effects of the COVID-19 vaccine are similar to the types of side effects we've seen with other vaccines, and they all typically resolve within a 1 to 3 day time frame. Next slide. So when people ask us this question, they say, well, this is what we know about the side effects of the vaccine, but do we really know enough about the side effects? And what we really want you to know is that there are millions of doses of the vaccine that have been provided worldwide. As of yesterday, February 17th, 186 million doses of vaccines have been provided around the world. And this is incredibly reassuring for us because what this shows us is not only are we documenting and keeping track of the side effects of the vaccine, which we've just talked about, but we're seeing this in countries around the globe. So we know that if there's new information to be had about side effects, we will find out very quickly because millions of doses are being distributed each day. And this is all very reassuring for us in knowing that the majority of people will have very low-grade side effects that are common and similar to other vaccines we've had in our lifetime.
So there have been some great questions about the safety of the vaccines for people with certain medical conditions. So there are some special considerations for people who have immunocompromised conditions or you're on immunosuppressive medications. So this means, for example, somebody who has cancer and is receiving chemotherapy, for example, or if you have an autoimmune disorder like multiple sclerosis and you're on maybe a biologic medication. In these circumstances, the vaccines are deemed to be most likely safe, but it's important that you talk to your healthcare provider about these specific health conditions. And the reason that we highlight these conditions in particular is because individuals who have these specific types of conditions, immunocompromised or autoimmune disorders, they weren't included in the vaccine trial. So we just don't have a lot of information about the effect of the vaccines in these conditions. However, when we think about how the vaccine works, scientists and researchers believe that these vaccines will be safe in these individuals, and that it's actually probably really important for these individuals to receive the vaccine because they may be at higher risk for becoming sick from COVID-19 infection. Other conditions like diabetes and asthma and high blood pressure and COPD, arthritis, all of these types of conditions, these were individuals who had these types of more common conditions were included in the vaccine trials, those big studies, and found to be safe and effective. So that's great news. But again, if you have questions, talk to your healthcare provider about your individual situation. There are lots of great questions about whether the vaccine is safe in pregnancy and breastfeeding. So again, the vaccine trials did not include people who are pregnant and breastfeeding. And that is very typical for the way that we test new vaccines, new medications, because this is, a different group. And we want to make sure that things are safe in people who are not pregnant and breastfeeding before we administer them to these groups. However, as things have evolved, the organizations like the World Health Organization and other expert groups like the Society of Obstetricians and Gynecologists of Canada have reviewed the evidence, and and state that the vaccines are safe to receive in pregnancy and breastfeeding. And this is based on how the mRNA vaccines work. When we look at it, again, it's not affecting your DNA, it's not affecting your genetic material, so there isn't really a reason to believe that it would cause a risk during pregnancy, either to the pregnant person or to the developing fetus, or during breastfeeding. And but what we do know is that there are risks of having severe illness of COVID-19 infection when you are pregnant. So this is an area that we're continuing to research to look specifically at the effectiveness and the side effects of the vaccines among individuals who are pregnant and breastfeeding. But increasingly, many pregnant and breastfeeding people are receiving the vaccines after they consider this information. So I have lots of colleagues and friends who are pregnant who are receiving the COVID-19 vaccine. This is a good time to talk to your healthcare provider if you have questions about pregnancy and breastfeeding. And I also want to note that in the trials, even though they didn't specifically include women who are pregnant, life happens. And so some people did become pregnant after they received the vaccine, or they found out after receiving the vaccine that they actually were pregnant. And the scientists, the researchers, followed those women and found that there were no safety concerns about the vaccine. So again, very reassuring about the safety and effectiveness of receiving the vaccines during pregnancy or during breastfeeding. Similarly, there are questions about, well, do the vaccines cause any problems for fertility? So, let's say I'm a person who's planning to become pregnant, and I don't know if I should receive the vaccine now because I don't want it to cause me to have difficulties becoming pregnant, or to cause some danger if I do become pregnant. So again, there's no evidence to suggest that there would be any problem receiving the vaccine if you're planning to become pregnant. In fact, it's actually probably a really good time to get the vaccine, because you want to make sure that you are protected against COVID-19 in case you become pregnant in the future. And there's, again, when we think about how the vaccines work, there's nothing to suggest that it would cause any problem for your fertility, any problem for your chance of becoming pregnant, or any danger for that developing fetus. And I'll remind you that we often give vaccines during pregnancy, so we really recommend that pregnant people receive the influenza vaccine so that they're protected against influenza, because they actually have a risk of becoming more sick. So there are certain vaccines that we don't give during pregnancy. Measles, mumps, rubella, and chickenpox vaccines, because those are live vaccines. So we don't give those during pregnancy, but many other vaccines we do administer during pregnancy, and we actually recommend during pregnancy. And it looks like COVID-19 vaccines falls into that category of being one that can be safely given and is actually recommended for people who are pregnant and who may be at risk of developing COVID-19. Another question, should I get the vaccine if I already had COVID-19? So the answer is yes. Even if you had COVID-19 in the past, we don't know how long you'll have your own natural immune protection, your antibodies from that infection. We don't know how long they'll last. And so you want to receive the vaccine so that you have that longer term protection against COVID-19. There are cases of people becoming reinfected with COVID-19 when they had the infection in the past. It's rare, but it does happen. So again, this is a reason that we recommend receiving the COVID-19 vaccine, even if you've had the infection in the past. I'm going to hand over to Priscilla to talk about how the vaccines were produced so quickly.
So this is a great question that we've had many times. People asking the question, well, we only heard about COVID-19 in 2020. How did the vaccine get produced so quickly and become available to us so quickly? And this is, while a busy slide to look at, it's a helpful one in understanding the process of vaccine development and how it's approved here in Canada. So routinely, and this is the standard procedure for vaccine development and approval in Canada, what we start with is scientists who develop a vaccine, and then they typically go to a preclinical stage where they start testing it in the laboratory and on animals. And then they go into clinical trials where essentially they have 3 phases that you can see listed here. And these 3 phases go from tens of volunteers to then hundreds of volunteers to thousands of volunteers. And they're asking the questions of the vaccine, is it safe and at what dose? They're asking about side effects. They're asking how well it works in larger numbers. Is it safe in large numbers of people and different populations? And they're asking about the most effective dose. And then they ask a very critical question in phase 3, does the vaccine prevent disease and illness, which is exactly what Dr. Vanessa spoke to earlier, and what are the side effects? So these are the process steps that are taken with vaccine development, and then it goes through to Health Canada for review. Vanessa, I'll just have you, thank you, click. So essentially, what made the process faster this time around in the case of COVID? We were fortunate in the sense that scientists were already working on sequencing mRNA-related viruses. And when they discovered the genetic sequence for COVID, they focused on it immediately, and funding was not an issue, which means that in some cases, when a vaccine is being worked on, sometimes there aren't a lot of other countries or funding sources that want to support the development of that vaccine. That was not an issue with COVID. I think we can all agree that around the globe, everyone felt this was an international priority. And as such, funding was readily available to support developing the vaccine as quickly as possible. Vanessa, I'll just have you take the next click here. The next thing that really helped us out was the fact that under other circumstances with other vaccines in history, perhaps there might have been an issue of finding patients who wanted to be participating in the trials. That was not an issue with COVID-19 vaccine trials. What we saw was there were thousands of people, as Dr. Vanessa mentioned, who were keen to participate in the trial, to receive the vaccine. And we also know that there was no shortage of exposure to COVID. So under other circumstances with other vaccine studies in the past, perhaps you might have to wait to see if there's a measles outbreak before you can test your vaccine to see if measles is protected effectively for patients. With COVID, that was not an issue. COVID virus is unfortunately a global pandemic issue, and as a result of that, people who were tested with the vaccine were also able to be followed over time to see if they developed illness in the context of an environment where COVID was present. And last of all, the other aspect that really moved this process along in a very effective way was the fact that Health Canada, our federal body that reviews all applications for vaccines, had something called a rolling review process. And we're going to go to the next slide now, and I'm going to speak to that a little bit more. So the rolling review process is essentially a process where within Health Canada, here under our federal jurisdictions, we have a team of experts at Health Canada. These are scientists, these are epidemiologists, individuals whose expertise is in reviewing vaccine data. And their job is to scientifically review all the data that was presented. And what they do then is, as they approve the vaccine, we've then seen the process of rolling out the vaccine, which we'll speak to in a moment. But this process was underway every time Pfizer and Moderna submitted data. And what's important about this is, rather than waiting until all the data had been collected years from now, what our scientific experts have done is reviewed the data in real time. And this has been exceptionally important because they're able to review it as it becomes available appreciating the importance of reviewing it swiftly but thoroughly. And I think that's what the take-home message here is that Health Canada and all of the scientists involved in ensuring this work has been done appropriately have not skipped a single step. What they've done is worked doubly hard to ensure that each step has been taken and reviewed thoroughly to give us good vaccine conclusions as much as we have available to us, so that the vaccines could become available as swiftly as possible. So some of the barriers that might have existed in the past were just not an issue this time around. Funding was available. There was existing mRNA science and technology around how to use mRNA in vaccines. And the moment COVID-19 became an issue on the global radar, the virus genetic sequence was immediately a focus for scientists. And there was international collaboration to make sure that this was a priority. And as a result of that, every Health Canada scientist and body that was focused on vaccine review did so in an efficient process. So these were all the steps taken to ensure that the vaccine was rolled out efficiently in terms of understanding that, yes, we can have approval as swiftly as possible. Next slide. So were the vaccines tested in diverse populations? This is a great question. And the reason it's important is because we all come from so many parts of the world and from different ethnicities and backgrounds. And we want to understand if Moderna and Pfizer studies had some considerations of this in mind. So what you can see here is that the Moderna and Pfizer vaccines were studied in a variety of different populations. Now, we will comment, both Dr. Vanessa and I, that this terminology you see listed here is not perhaps the terminology that we ourselves use at the Crossroads Clinic, but it is the terminology that they used in the studies. And as such, you can see that between 79 to 83% of the study populations were considered white. Now, I will always preface by saying that white doesn't mean that everyone came from one particular country or ethnic background, because there's such a broad array of countries and ethnic origins that might have fallen into that category. You can see that 9 to 10% were Black or African American, and then about 4 to 5% were Asian. Further down the list, you can see Indigenous communities were represented. Some multiracial percentage of the population was also part of the study. And then the Hispanic and Latino populations were about 21 to 28% of the population studies. So what we're seeing here is quite a degree of diversity, and that will only become more apparent as the vaccines are being distributed and rolled out around the world. We'll see more and more studies developing over time around this. One of the big take-home points here is that the vaccines were equally effective in people of different racial and ethnic backgrounds. So it didn't matter which country people were born in, and it certainly didn't matter what their ethnic heritage was. What's important is that the vaccines worked equally well, up to 95% efficacy, as Dr. Vanessa mentioned earlier, in all of these populations.
All right, so now we're going to talk about what is in the COVID-19 vaccines. This question comes up a lot. So I'm going to look at the two different vaccines. So in the Pfizer vaccine, again, that medicinal ingredient, the thing that makes it work is that messenger RNA, that instruction sheet. The non-medicinal ingredients essentially include fats, salts, sugar, and water. Kind of sounds like junk food. But when we break it down, what are those fats? Well, these are the big, complicated chemical names. And so you can see the specific components listed out here, but to break it down, these are fats, salts, sugar, and water. Similarly, in the Moderna vaccine, the medicinal ingredient, again, is the mRNA, and the non-medicinal ingredients include the fat, salt, sugar, water, and also acid stabilizers. And again, here are those longer, more complicated chemical names. I want to draw your attention to polyethylene glycol. And you might have heard about this. It's also referred to as PEG because this is actually a really common substance. It's found in laxatives like Restoralax, for example, which we sometimes use for constipation or bowel preparations if you've ever had a colonoscopy and needed to clear out your bowels. It's actually also included in quite a few cosmetic products like creams or makeup, in some toothpaste, and it's also included in a lot of common medications like Advil liquid gel or extra strength Tylenol or Tylenol gel caps, enteric-coated aspirin. So this is a very, very common substance, but if you have an allergy to polyethylene glycol, to PEG, then there's some caution in receiving the vaccine. And you need to definitely see an allergist to talk about this. Because PEG is so common, because polyethylene glycol is so common in all of these products, if you have an allergy to it, you know it because you've been exposed to PEG somehow in your life. And so you've already experienced that allergy. So this is to provide some reassurance that, the substances that we see, it's unlikely that you'll have an allergy to any of those ingredients, except for those rare people who may have an allergy to polyethylene glycol, and they will know that because they've had an allergic reaction in the past to polyethylene glycol. So what's not in the vaccines? There are no food products, no nuts, no antibiotics, no thimerosal, no formaldehyde, no fetal cells, and no microchips. And so this, again, is to reassure you, some people may say, well, I've got an allergy to penicillin. Is it safe for me to get the vaccine? We would say yes, because the vaccine doesn't contain penicillin. Or I've got an allergy to peanuts or to milk. Is it safe for me to receive the vaccine? And we would say yes, because it doesn't contain those products. If you do have an allergy, what we recommend is that you wait for 30 minutes after receiving the vaccine instead of the standard 15 minutes. And this is because if you're going to have an allergic reaction, it will generally happen within that 30-minute time frame. And wherever you receive the vaccine, there are always medical staff that are available to deal with those allergic reactions. They have EpiPens available if you start to have a severe allergic reaction that can help you. Again, as Dr. Prasida mentioned, the actual prevalence of allergic reaction to these vaccines has been extremely rare, but we always want to be careful. And that's why we make sure that people wait and that there are medical staff that are available to provide any assistance that you might need after receiving the vaccine. Now, where would we advise some caution in terms of receiving the COVID-19 vaccines? So if you have had a severe allergic reaction to any of the vaccine ingredients, including PEG, polyethylene glycol, or if you've had a severe allergy to prior COVID mRNA vaccines, then you should talk to your healthcare provider and see an allergist to determine if it is safe for you to receive the vaccine. So right now we would say if you are in these categories, you shouldn't get the vaccine yet. You should talk to an allergist, a specialist in allergies, to see if it's safe for you to receive the vaccine or how you can receive it in a safe way. But again, this doesn't apply to having an allergy to peanuts, to milk, to other substances that are not the ingredients of the COVID-19 vaccines. So Dr. Prasida is going to tell us, well, what happens after receiving the vaccine?
Thank you, Vanessa. So what happens after we receive the vaccine? There's a few important points we really want you to understand from this piece. So when we receive the vaccine, it's really important that we understand that our immunity is boosted. As Dr. Vanessa mentioned, the studies have looked at the importance of receiving 2 doses of the vaccine. And what we know is that our immunity is boosted with the first dose, and then our immunity is exceptionally strengthened by the second dose. What is unclear is if we can still carry the virus. So the studies that Dr. Vanessa mentioned earlier looked specifically at the importance of receiving the vaccine and ensuring that people weren't getting sick with COVID illness after having been vaccinated. What we don't know is if people can still carry the vaccine, even if they don't get sick. Now, some people will still get symptomatic illness. So what does that mean? That means that in theory, the vaccines are fantastic. They're 95% effective, which means they protect us 95% of the time from getting sick with COVID illness. But they're not 100% effective. And if they're not 100% effective, there's still that very small possibility that someone could still get sick with the vaccine. It's unusual and unlikely, but it is still possible. So we need to remember that and still exercise all of our standard physical distancing measures, which we'll remind ourselves of in a minute. The third thing we really want you to know is that sometimes people can still develop a fever, perhaps a day after the vaccine, perhaps several days after the vaccine. And what we want you to remember is that, yes, it's possible it could be a side effect from the vaccine itself, but you can't rule out the possibility that a few days before you had the vaccine, you might have been exposed to COVID illness somewhere in our day-to-day lives. So the most important take-home message here is if you develop a fever after receiving the vaccine, we still want you to go and get COVID tested. Best to rule it out, best to make sure you haven't had an exposure from some prior time in the previous week before you received your vaccine. And subsequently, we can continue with all of the measures we know so well. So as you see listed here, after you've had your vaccine, you are, we hope, over the course of those 2 doses, building your immunity and hopefully strengthened in your protection against getting COVID illness. But we still do everything we can to keep ourselves and our families and our community safe. And that means we still stay home as much as possible. We still maintain good physical distancing, at least 6 feet or 2 meters apart. We still wear our masks as protective equipment, and we wash our hands frequently and ensure that we try to limit being in large physical crowded spaces. So the next question that we've had come out often is, what is the plan for the vaccine rollout and who is eligible? So again, this slide is a bit of a busy slide, but what we really want you to think about is what you've actually already been hearing in the media. So essentially, as of December the 15th, phase 1 of the provincial rollout here in Ontario began. And what we saw happening was that there were certain priority populations that were the focus of these initial vaccine doses. And what that meant is as the vaccine arrived in Canada, healthcare workers in hospitals, healthcare staff working in long-term care homes and retirement homes, and the residents who lived in those settings, as well as congregate care settings and Indigenous communities in remote areas, were the focus of phase 1. Phase 2 is actually what we're in the middle of right now. So this winter, as more and more vaccine becomes available, what we're seeing is the emphasis on trying to reach all healthcare workers, trying to reach residents in all long-term care homes and retirement homes who are very elderly and often quite frail, reaching our home care patients who often have significant chronic conditions, and again, reaching out to Indigenous communities. Phase 3, which you see listed here, will be what comes over the course of these coming months ahead. In the spring and onwards, we hope that vaccines, as procurement and larger shipments arrive, will become more widely available across Ontario for anyone who wants to be immunized. And I think that's what's really important here, is understanding this piece. Next slide. Vaccines are free, and these are vaccines that we want everyone here in Ontario to have access to and across Canada, and that means that an OHIP card is not required. So I don't want any of you to hesitate for a moment to think about whether or not you have an OHIP card or you don't. That is not an issue here. The vaccines are available, and when your turn becomes available to you, we hope you'll think about all of the information we've shared with you here and know that whichever health coverage you do have, vaccines will be available to you.
So we want to let you know that we are sharing this information so that you have your questions answered, and that we are not just saying this, but we actually really believe it. So that's me receiving my vaccine, that's Dr. Prasida receiving her vaccine, and these are other members of the Crossroads team. And we all, after reviewing the evidence of the vaccines, reviewing the safety, the effectiveness, have confidence in the vaccines to keep ourselves safe from COVID-19. And so we all decided to receive the vaccine, and we feel very fortunate that we had the opportunity to receive the vaccine as healthcare workers who are working with individuals who have COVID-19 in order to protect ourselves, and we hope to also protect our community. So in summary, we have looked at all of this information, and I hope that we have been able to convey that the vaccines are well studied, they're safe and effective, and that we recognize many people, including potentially many people on this call, are at high risk of COVID-19 because of exposures in work, in public transit, in housing, and that vaccines protect you. And so we hope that this has helped to answer some of your questions so that you might feel more comfortable in receiving the vaccine when the opportunity arises for you to be eligible to receive it. But we hope that this can be an ongoing conversation. And we'll open up now for questions, and also we'll let you know that we are available if you think of other questions down the line, that we want to be a resource to continue this conversation and to continue answering those questions. So perhaps, Elisa, you can help us to open it up to the question and answer period of the webinar.
Okay, yeah, sure. If you want, I can read the questions for you.
Sure.
If that is easy for you. Because you can see the questions also on the toolbar on your right side of the screen. What is better for you, it's okay.
Sure. Do you want to read the questions for us?
Of course, sure.
Thank you.
Okay. The first question is, thanks, Dr. Janitaram and Dr. Vanessa. Could we watch and listen again this conference, or it's being recorded? I think yes.
I will leave that to the organizers of the webinar. Can you speak to that, Elisa or Carolina? This has been recorded?
Yes, of course.
Of course, yes.
Great.
The presentation has been recorded, and we will send the link to all the participants as soon as we finish. Everyone receive the link. Okay.
Great. I see that there's a question about.
Are you able to choose what vaccine you want?
Yeah, so this is a great question, and it's one that has come up at times in our practice. So at this point, there isn't the availability to make a choice. But that may change in the future as more vaccines become available and are more widely available at different sites. At this point, Health Canada has approved the Moderna and Pfizer vaccines, which again, as we outlined, have a similar mechanism of how they work. They're both the mRNA vaccines, and they're both remarkably effective, 94 and 95% effective, which is excellent. What I would say is, if your chance comes up to get the vaccine, to get the one that's available, but we may have more information in the future as more vaccines are rolled out regarding a choice.
And I would add to that, as Dr. Vanessa said, both the vaccines are truly excellent, and as we showed you, also quite similar in many ways. What I think is important to understand is part of the reason at the moment that the vaccines are not available with a choice has to do also with the way in which, as you may have already been reading or hearing about, the vaccines need to be stored in particular conditions, and also to be administered under specific scenarios or conditions. So the vaccines are being distributed to different areas and regions based on transport, based on storage recommendations and needs. So a lot of other factors are in play when we think about how to get the vaccine to people and communities and to where people live.
Great, that's a really excellent point. I see a question about other vaccines that are not Pfizer or Moderna. So this is a great question. You're probably hearing in the news about the rollout of AstraZeneca and the Johnson & Johnson vaccines, and there are other vaccines that are being used worldwide. Different vaccines have different ways of working. Right now, the Pfizer and the Moderna vaccines are the ones that are approved for use in Canada. Health Canada is actively looking at the data for the AstraZeneca and for the Johnson & Johnson vaccines, and so those may become available in the future, and perhaps we can actually organize another webinar to discuss those vaccines in particular.
And I see the next question here is, will it be possible to get the full information about the components of the Pfizer and Moderna vaccines? So that's a great question, and Dr. Vanessa covered some of the specific components of the vaccines, but certainly that information is readily available, and not just through us, but actually through many sources, including sort of being able to read the full vaccine makeup of each vaccine.
And so actually, if you go on to Health Canada, if you just search online, Health Canada COVID-19 vaccine, you can see the full information about the vaccine components, or looking at the Pfizer or Moderna websites, the full list of ingredients is there in detail. I see another question about, I've heard some people get COVID after receiving the vaccine. How long after getting the vaccine will you develop immunity? So this is a really great question, and there are a couple of different components to answering this question. One is that some individuals may test positive for COVID-19 after receiving the vaccine because they were actually exposed to it even prior to getting the vaccine. So let's say on Monday you had contact with somebody who was infected with COVID-19, the virus is transmitted to you, you feel fine. On Friday you get your vaccine, and then on Saturday, you develop symptoms and you go for testing, you find out that you're positive. Well, that is actually because you got exposure to the virus. You got infected with the virus several days before receiving the vaccine. That's one component. Another component is that, as Dr. Prasida mentioned, the vaccines are extremely effective against preventing COVID-19 illness, but there still is a possibility that you might actually get COVID-19. You might get the virus in your body. It might not cause you any problems, but we're still learning if you can pass it along to other people, right? There's some promising data to suggest that the vaccines do help to lower the risk of spreading COVID-19, but it's something that we're still learning about. And then to the question about, well, how long after getting the vaccine are you immunized? When we talked about those numbers of being 95% effective against getting sick from COVID-19, that was those numbers looked at 7 days after getting the second dose and 14 days after getting the second dose in the case of Moderna, so Pfizer and Moderna respectively. So we think that your body's immune system starts to develop immune protection within a couple of weeks after receiving those vaccines, but your immune response is further strengthened after you get the second dose.
The next question here is, for someone with severe seasonal allergy, is there danger to getting the vaccine? So this is a great question, and one that comes up often is when someone has an allergy, for example, to seasonal issues in the fall or the spring, or an allergy to food, is it still safe for them to get the vaccine? And Dr. Vanessa mentioned this as well and spoke to this point to reassure you that certainly in the context of seasonal allergies, environmental allergies to dust or to leaves or grass or particular flowers or pollen in the environment, those are all issues that are not an issue when you get the vaccine. So there's no danger to getting the vaccine in that scenario. Similarly, if you're allergic to, as Dr. Vanessa mentioned earlier, milk or nuts, or have food restrictions with meats of certain kinds, none of those things are contained in the vaccine. So none of those things are a danger in terms of getting COVID vaccine. COVID vaccine does not contain any of those products.
There's another question. Some people are concerned about possible long-term effects of mRNA types of vaccines. How can we reassure them? This is an excellent question. So it's helpful for us to think about how vaccines work in general. So the safety effects, the side effects that we might have from a vaccine will occur generally within the 6 weeks after receiving the vaccine. So in the studies, people were followed for more than 2 months after receiving the second dose of the vaccine. And actually these individuals, those were from the published studies that came out in December, and those individuals who received the vaccine are still being followed to see if there are any additional side effects, any safety concerns, which are not arising. The side effects that Dr. Prasida outlined were the ones that were identified in those studies. So just kind of the routine side effects from receiving a vaccine. So in terms of the way that vaccines work, there isn't a mechanism to suggest that there would be a long-term effect of these vaccines that we're going to see in a year or in 2 years. An important thing to note, however, is thinking about the long-term effects of COVID-19 illness. And while the rates of death and ICU admissions and severe illness are highest among those people who are older in age, there are long-term effects of COVID-19 even in young people. So we're seeing, you may have heard about the term long COVID or long haulers, and this refers to people that are having ongoing effects of fatigue, kind of brain fogginess, decreased exercise tolerance and energy, body pains after having the COVID-19 infection. So, whenever we are thinking about risks and benefits, it's helpful for us to think about, well, what are the risks of receiving the COVID-19 vaccine? what do we know about it, but also what are the risks of not receiving the COVID-19 vaccine? What are the risks of becoming sick from COVID? And of course, it's always kind of thinking through those risks and benefits. And I think another thing that I'll just add to the answer is that we are continuing to study. There is so much research around COVID and around the vaccines. So there is ongoing monitoring to ensure the long-term safety of these vaccines.
And how are we doing for time? I just want to check in with Carolina and Elisa.
It's okay. You can continue.
I think we have until
we have a lot of participants, and I think we have more questions. So feel free.
Okay, super. So I'm double checking, Vanessa, with the questions that
I see a question. I hear that some people die after receiving the vaccine.
Okay, so I know that this can be an anxiety for many people, especially when we're hearing reports and we don't know where that information has come from or where the research or the science behind some of this information comes from. So I think it's really important when we hear reports like this, we want to ask ourselves a few questions. We want to ask ourselves, where is this information coming from? We want to also clarify, is it coming from a reliable and trusted scientific source? So for us, it's really important when we go back to the studies to say that when we hear that 95% of population studies of 30 and 40,000 people received the vaccine and were protected and safe and well against COVID illness, that is incredibly reassuring for us. Is it possible that there are going to be those individuals who are the rarity, who have a complex anaphylactic scenario? Yes, we said that with Pfizer, in fact, those numbers were close to 4.7 people out of 1 million. And in the case of Moderna, they maybe had a 2.5 people out of 1 million. And again, that was for an allergic anaphylactic reaction where they had a severe allergic reaction. It did not mean that there was death. And I think that that's really important when we're thinking about where we're getting our information from. Can we say that no one will ever have a scenario where they've had the vaccine and then there is an unforeseen death? I don't think we can ever say never, but what we can also say, it's important to think about the other factors in play. How old was this individual? Did they have other medical conditions that maybe were part of the contribution to anyone passing away? What we know is that the safety data around the COVID vaccine is very reassuring, and that there is no association here with the vaccine and specifically seeing someone pass away or die. Vanessa, I don't know if you have more to add to that.
Yeah. So I think that just to add on to what Priscilla was saying about when we think about who is receiving vaccines right now. So these are very elderly and often frail individuals in nursing homes who are being prioritized for the COVID vaccine because they are at high risk for becoming ill from COVID-19. Now, these are also individuals who may be in their 80s and 90s in these long-term care homes who have a lot of health conditions. They have heart disease. They already have lung conditions. And there is a high rate of expected mortality just outside of COVID-19, outside of vaccines, that because of their age, people may pass away for other reasons because of their other health conditions. So it is possible that someone may pass away, a week after receiving the COVID-19 vaccine. We may hear that, but we have to go back to think about, well, what did they pass away from? Maybe they passed away from a heart attack because they've had a long-term heart condition, and that had nothing to do with the vaccine. So again, I think Prasita's point is really important about thinking about where is our information coming from, is it reliable, and is it asking those questions rather than just jumping to a conclusion. And I want to acknowledge how difficult it is because there is so much information that is floating around on the internet about COVID and about the vaccines. And so it's really important that we look for reliable sources. And I see somebody has asked for the links, and we will certainly share links to reliable information about the COVID-19 vaccines from Health Canada, from public health sources. We can post the exact links to the studies if you want to look at it yourself. And we also have additional information that's available translated into different languages that may be helpful. I see there's another question. So there is still a 5% chance of getting COVID or getting sick from COVID after being vaccinated. What would be the symptoms in this case? So that's a great question. The symptoms could be the same as COVID-19 symptoms with or without the vaccine, right? So and the tricky thing about COVID is that it has so many different symptoms. Some people don't have any symptoms. Some people get a cough, difficulty breathing, sore throat, feeling like you have a cold, achy muscles. Some people get some nausea and vomiting and diarrhea and stomach pain. Some people lose their sense of smell, sense of taste. So if you have any of those symptoms, we still recommend that you get tested for COVID-19. Other questions? Any other questions that you have, Elisa, that you've been hearing about, or from Carolina?
I think those are all the questions. Yes, I think we are okay now. I don't see any new questions. Ellie, do you see something?
Or questions that you might have heard?
No, I don't. I think they're all.
Or questions that you've been hearing from other folks that would be helpful for us to address?
Well, I believe you answered
usually
all the questions, but Ellie?
Yeah, exactly. All the questions have been answered during the presentation, especially for people who are doesn't have OHIP. They are also asking if they are going to receive the vaccine, where you already said about that. So I think we have covered, but in case that somebody have another question, just type it and that's it.
Great.
Yeah, we really appreciate the presentation has been really informative. Thank you very much.
It's our pleasure.
It's our pleasure, absolutely. And, in terms of just thinking about where and when the vaccine will become available in different settings, I want to encourage everyone who's listening to be aware that the vaccine may be offered to you in a range of different scenarios. It might be where you work, it might be through shelters, there might be large vaccine centers that you have information about that you can go and access as well. So everyone stay connected to your healthcare providers and to the wonderful team at FCJ, because there will be more information coming about this, and feel free to always ask your questions. There's been some really great questions today, and I think that that's how we learn, that's how we give ourselves knowledge and information.
Well, thank you again to all our participants also for joining us in this webinar. And remember that you will have access to this video. We hear some questions at the beginning about the availability of this information, and And we will send you, as soon as it is ready, we will send you the link.
Thank you so much,
Thank
everyone.
you so much.
Have
Thank
a
you,
great
everyone. Have
Take
a great
care.
day.
Thanks. Bye-bye.
Bye-bye.
Thank you. Bye-bye.